Hello, I'm Dr. Mona Morstein. I'm a naturopathic physician at Arizona Integrative Medical Solutions. I'm going to talk right now about type 1 diabetes. In the naturopathic profession, I'm the main speaker on diabetes, and I've been working with diabetic patients for 2 decades. Type 1 diabetes shows up generally at 2 different times of life. It is that juvenile onset that comes on very quickly, and that usually starts when children are from about 1 year old to about 25 years old. And what happens is, of course, they start losing weight, being tired, urinating a lot, and they get diagnosed with type 1 diabetes. There's also a second kind of type 1 diabetes that tends to occur in adults from around 35 to 55. It's called LADA, latent autoimmune diabetes of the adult. And it's a very slow onset diabetes where people are lean and they aren't those big type 2 people, but oftentimes they get misdiagnosed as type 2. If you're a lean type 2 diabetic who's been exercising and still got diabetes, you should be tested to see if you have LADA. Both the childhood and the LADA diabetic are due to damage to the pancreas, so that you're not producing enough insulin to process your meals, right? So this is the process that's going on in the kids. We have a very big damage to the pancreas right away. With the LADA patients, it's just a little bit slowly over time for most people. In general, these are going to be diseases where people are dependent on insulin, whether they're injecting them with a syringe and vial or with a pen, or you get a pump. This is generally how it's very quirky, but generally with kids, they're told to eat what they want and cover it with insulin. That is so ineffective. It's amazing. It's just bad advice, okay? And so what we want to do with our type 1 patients is really make some fairly drastic changes that can get these people under control right away. With some acute onset type 1s, we can get them off of insulin, and oftentimes for a long time, years, before they may need to go on it again. With our type 1s on insulin as adults, we can cut their insulin in half and still have them under really good control. How do we do this? We work on the diet in very specific ways. We do supplementation, make sure they can exercise without getting lows, and just work on their sleep and stress management. What we're looking for are people that have very steady blood sugars and aren't doing this all the time. They come into me like this, but we usually straighten it out, lower their A1C, reduce their insulin, and they do great. So you need to find a doctor who can work with you in an alternative way with your type 1 and who is knowledgeable with insulin. For me, I'm very comfortable with insulin. I actually teach a seminar called Insulin Intensive Seminar to physicians and doctors, to doctors and students on how to work with insulin with patients. So if you're looking for alternative medicine for your type 1 child or for yourself, consider me, Dr. Mona Morstein, at Arizona Integrative Medical Solutions.